Diabetics are generally sweet. Hi friends, in today's video we are going to see about the topic diabetes. So without wasting any time, let's move on to the topic. So going back to the history, we see that diabetes was probably coined by Apollonius around 250 BC. But in 1776, Matthew Dobson confirmed that the diabetes was due to the presence of excess of a kind of a sugar in the urine and blood of the people with diabetes. But before moving on further, please subscribe to the channel and press the bell icon to receive the latest updates. Then, Avicenna was the first to describe diabetes insipidus very precisely. It was much later in the 18th and the 19th century that Johann Peter Frank differentiated between the diabetes mellitus and diabetes insipidus. So, the diabetes is of two types, that is the diabetes mellitus and diabetes insipidus. So, let's see each of them in detail. Diabetes mellitus, commonly referred to as diabetes, which is a chronic disease associated with abnormally high levels of sugar glucose in blood. And the diabetes here is due to the two mechanisms. One, due to the inadequate production of insulin, and the second reason is due to the inadequate sensitivity of cells to the action of insulin. So basically, there are two main types of diabetes mellitus, and they are type 1 diabetes and type 2 diabetes. So the type 1 diabetes is a condition in which your immune system destroys the insulin making beta cells in your pancreas. Basically, this condition is usually diagnosed in children and young people. So it is also called as juvenile diabetes. So coming to the symptoms, we can see that the symptoms are often subtle but they can become severe. And the symptoms include the extreme thirst, dry mouth, frequent urination, upset stomach and vomiting, blurry vision, frequent infections of the skin, urinary tract or vagina, and also mood swings, and particularly in child, bedwetting at night is seen. But in emergency conditions, the symptoms may lead to the rapid breathing, belly pain, loss of consciousness, which is rare, and fruity breath. So, what does this type 1 diabetes cause? The type 1 diabetes damage the beta cells, and these beta cells do not respond because the insulin is not there to do the job. And then, because of this, the number of cells build up in the blood and the cells starve. And this ultimately causes high blood sugar, which can lead to dehydration, weight loss, and ultimately the whole body can be damaged. What are the risk factors of type 1 diabetes? So, you are at higher risk of getting diabetes type 1 if you are younger than 20, if you are pale in color or fair in color, or you have a parent or a sibling who is having the type 1 diabetes. The diagnosis: if your doctor thinks you have type 1 diabetes, then he or she will check your blood sugar level. They may also get you the urine samples for the glucose or chemicals that your body makes when you don't have enough insulin. And by that, they can detect that the type 1 diabetes are there or not for the patient. The treatment: people with type 1 diabetes can live long and have healthy lives. You just need to keep a close eye on your blood sugar levels, and your doctor will give you a range that the numbers should stay within. So adjust your insulin, food, and activities as necessary. And the most important point is everyone with type 1 diabetes needs to use the insulin shots to control their blood sugar. The complications: the type 1 diabetes may also complicate to the cardiovascular diseases, skin problems such as fungal infections, pregnancy problems, retinopathy, and also kidney damage can occur. And also there can be poor blood flow and nerve damage can occur. Changes in the lifestyle. Exercise is an important thing for treating type 1. You will also need to understand how food affects your blood sugar. A diabetes educator or registered dietitian can help you to get started. The type 2 diabetes. It is a lifelong disease that keeps your body from using insulin the way it should. People with type 2 diabetes are said to have insulin resistance. The people who are middle aged or older are most likely to get this kind of diabetes, so it is called as adult onset disease. But the main thing to notice that the type 2 disease or the type 2 diabetes can also affect the kids and the teen, and it's mainly because of the childhood obesity. Symptoms. The symptoms of type 2 diabetes are very mild that you don't notice them. About 8 million people who have it don't know it. These include frequent urination, being very thirsty, numbness in hands and feet, unhealing wounds, frequent hunger, weight loss without trying, and getting more infections and diseases easily. Dark rashes around your neck or armpits, called as acanthosis nigricans, is often a sign of type 2 diabetes, that is, insulin resistant. And these symptoms can also be called as emergency symptoms. So, what happens in the type 2 diabetes? Usually, your pancreas makes a hormone called insulin. It helps your cells to form a type of sugar, that is glucose, from the food you eat and which ultimately converts into energy. But in case of type 2 diabetes, the insulin that is made is not utilized well by the body as they should. Usually some combination of things causes type 2 diabetes. They include genes, extra weight, metabolic syndrome, and broken beta cells or damaged beta cells. So coming to the risk factors, so this is very risky for the people who are aged 40 or plus, or they have someone in the family like a parent, a sister, or a brother with diabetes, or if their ethnicity is African American from Alaska, or they are native Pacific Islander American, then it's very risky. Risk factors related to your health and medical history include prediabetes, heart and blood vessel disease or disorders, being overweight or obese, having a baby who weighs more than a pound, stress, and smoking. The diagnosis. Usually, the doctors let you know within 2 days that if you have the type 2 diabetes or not. But if your blood glucose is very high, then only one test is enough to confirm that. The tests that are done to detect the type 2 diabetes are the A1C test, which is the major one, the fasting plasma glucose test, which should be done in empty stomach and it's used to measure the blood sugar, the oral glucose tolerance test. The treatment. You may be able to reach your target blood sugar levels with diet and exercise alone. Some of the things that one can do to control this are weight loss. Weight loss can seem overwhelming, but portion control and eating healthy foods can control the blood sugar levels. Healthy eating habits. There's no specific diet for this. Just focus on eating fewer calories, adding veggies and fruits to your diet, and getting more fiber. And here comes the most important topic, that is medication. If lifestyle changes don't get you to your target blood sugar levels, then you may need medication, and here are some of those: metformin, sulfonylureas, thiazolidinediones, DPP4 inhibitors, and insulin. Prevention. So, to prevent this type of diabetes, the main thing is to lose weight, to get active, to eat right and healthy, and mainly the smokers should quit smoking. Complications. Over time, high blood sugar levels can damage and cause problems with your heart and blood vessels, kidneys, eyes, nerves, skin, and can lead to loss of hearing, damages in the brain, and complications in pregnancy. The best way to avoid these complications is to manage your type 2 diabetes well by taking your diabetes medication or insulin on time, by checking your blood sugar levels, by eating right and not skipping the meals, and see the doctor regularly to check for early signs of trouble. So, coming to the nursing management, so the first one is foot care. Daily foot care and inspection should be always maintained, and always wear protective shoes or slippers. Avoid temperature extremes and also keep immediate medical attention for any injury or problem. Prevention of urinary retention must be seen, and monitor for fixed heart rate with activity. Thanks for watching this video, guys. Like the video, subscribe to the Dr. Great channel, and show your support to me, and share this video to everyone as much as possible. And if you have any suggestions, please put that down in the comment sections below. And once again, thank you all.